Hello, welcome to today's episode on Dr. Soma's Corner. This particular one will be discussing on how to maintain a healthy kidney. We'll take you through what the kidney is, its functions, what puts you at risk of developing kidney problems, and what can you do as a person to maintain a healthy kidney. It is a common knowledge that maintaining good health and happiness is paramount to longevity, and keeping up with healthy choices as a healthy lifestyle is a race against time. And that is because any time, any day, any year lost can never be regained. Every year, millions of people are diagnosed globally with kidney failure, and a good number of these persons end up dying from the disease. This is more so, especially in regions of poor socio-economic status. The kidneys are a pair of bean-shaped organs located below the rib cage, specifically on the area of the posterior abdomen. Each measures about 4 to 5 inches, that should be about 10 to 12 centimeter long, and weighing about one third of a pound, that should be about 250 grams. They are a powerful chemical factories that produces a lot of or performs a lot of functions such as removal of waste products from the body, removal of drugs from the body. They help balance the body fluid and electrolytes. They help in production of hormones that help regulate blood pressure. They produce the active form of vitamin D that promotes strong and healthy bone. They also controls the production of red blood cells in the body and a lot more other functions. One might ask the question of why does the kidney fail or does the kidney fail in its function? And the answer is yes. Like I mentioned previously in the introductory part, that globally millions of people are diagnosed with kidney failure every year, and a good number of persons from the diagnosis that are diagnosed with kidney failure die from the disease. The kidney can actually fail. It can be an acute kidney injury happening suddenly and oftentimes can be reversible, or chronic kidney disease, which is a disease condition of the kidney happening over a long time and might ultimately lead to failure. So the kidney can fail due to certain reasons, which we will explain as we go further. So, but the important thing we may need to discuss next is what are the risk factors? What puts you at risk of having kidney failure? What causes kidney failure? There are various factors that put one at risk of developing kidney failure. One is diabetes. Secondly, hypertension. Others include polycystic kidney disease, urinary tract obstruction, autoimmune diseases where your body fights itself, certain medications, severe dehydrations, and many other disease conditions, including untreated systemic disease conditions such as heart disease, liver disease, etc. In addition to the disease condition mentioned, there are certain or common habits that we often exhibit that can affect the kidney function. One is overuse of pain medications, those of us who abuse pain medications, increased salt consumption, those who doesn't take enough water, too much processed and ultra processed food, too much eating of meats, poor sleep, too much food high in sugar, smoking, excessive alcohol intake, physical inactivities, reckless consumption of herbal medications, and many other habits. Now, there are certain signs and symptoms that may suggest that someone might have kidney failure, kidney disease. One, you might be having nausea, you feel like vomiting every now and then. The person might actually be vomiting, having recurrent vomiting. The person might have loss of appetite, or food might taste metallic in your mouth. There might be disturbances with sleep, and there may be changes in the urine output, most likely a reduction in your urine output. There might be decrease in your mental alertness or mental sharpness. There might be muscle twitches and cramps, swelling of the feet, ankle, hands, and the face. And the person might also have high blood pressure. Now, to the main issues of the day, which is how to maintain a healthy kidney as an individual, it is very essential to understand that maintaining the kidney at its maximal function will help not just your health but your overall well being. So, we are going to be taking it step or one after the other. The first is regular exercise. This can help prevent chronic diseases. Remember that I mentioned that a couple of chronic diseases can predispose you to having kidney problems, such as diabetes, hypertension. So, if you have regular exercise, it can help you to prevent development of these chronic diseases that can predispose to kidney damage. Secondly, drink plenty of water, plenty of fluid. Staying well hydrated by drinking enough fluid will help the kidney function properly. Urine should be straw colored. A dark urine could mean you are dehydrated. Thirdly, ensure to control your blood sugar, especially for those who are diabetic. Poor blood sugar control can lead to diabetic nephropathy and consequent kidney failure if not well taken care of. Number four, ensure you monitor your blood pressure. Having a regular blood pressure check is recommended. If you're hypertensive, the more reason why you should be checking your blood pressure regularly because poor blood pressure control can affect the kidney negatively. Monitor your weight and eat healthy diet. A healthy diet is prerequisite for maintaining one's weight within normal range. Overweight and obesity can cause increased workload for the kidney and can predispose to the development of a lot of chronic diseases that can impact negatively on the kidney. Avoid smoking. This is because smoking can damage the blood vessels and thereby reducing blood flow to the kidney, which is a risk factor for causing further damage. Smoke has also been implicated as a predisposing factor for the development of kidney cancers. Reduce alcohol or cut down on alcohol. Alcohol have been implicated in many chronic diseases such as liver disease, hypertension, cancers, and kidney damage, especially those of you who engages in binge drinking. Also, ensure to have screening, have your kidney function test done annually. If you are at high risk of developing kidney disease, this is very important for you. And if you notice on the testing that there is an abnormality, it's even recommended that you do it more than once a year and you need to see a specialist. In conclusion, I'd like to say that optimum health is maximum wealth. You might not be able to control certain risk factors that predispose you to having some disease conditions, but you sure can control your lifestyle to reduce the chances of having those diseases. Eat healthy, live healthy, and embrace longevity. I hope you've been able to pick up one or two things that will help your lifestyle today. See you next on our next episode.